Next presenter is Mr. Mee Gon, researcher of Department of Income Security Policy of the Korea Institute for Health and Social Affairs. Definitely Mr. Kim is one of the experts who knows the social environment of Korea best. So Mr. Kim, please. As the moderator just introduced, I am Mee Gon. I am researchers of the Department of Income Security Policy of the Korea Institute for Health and Social Affairs. The institute is working on research of social affairs, demographics, and health policies. So those are the three major areas that we are researching on. Today, I'd like to talk about social policy paradigm and direction in the post-COVID-19 era. So what kind of paradigm shift should we make, and what is the direction for the futures in terms of social policy? So these will be explained by me during my presentation. What is the root cause of a pandemic? So that was already explained by the previous speakers, and this is often cited that what is often cited is that a pandemic is caused by environmental destructions, and growth-centered views, materialism, and fetishisms are causing environmental destruction. As stated by Mr. Noam Chomsky, a pandemic is not a natural disaster, but a man-made one. And second thing that I want to talk about to you is in the post-COVID-19 era, what changes will we see? In fact, a pandemic is inflicting an economic crisis, and that leads to a crisis to communities. And when that happens, the general public usually express a diverse demand and needs, and the intellectuals, they demand for a paradigm shift. So this is the general flow. So I'd like to talk about this. And first, as for epidemic is a we are moving from the epidemic to pandemic. Just 1 or 2 months ago, there were people who doubt that the COVID-19 will go into pandemic. So now, actually, people are saying that the COVID-19 is going into an endemic. So there are questions concerning whether the COVID-19 will become an endemic or not, but now it's coming as an endemic. So when it comes to economic crisis, there are 3 levels, 3 steps, but now we have entered into the second step. In the stage of epidemic, social distancing is practiced. In fact, the social distancing is not the accurate word. Actually, I would say physical distancing. So under epidemic, physical distancing is practiced, causing harms and difficulties to small business owners and to the vulnerable. And step 2 is pandemic. So step 2, under the second step crisis, there is a crisis to the manufacturing industry. And in step 3, that crisis goes into the financial sector as well. And now I think that we have just entered the step 2. There are many opinions about economic recovery, but V-shaped growth or U-shaped growth. However, such things cannot be expected at this stage. One of the most positive prospects that we can make at best is that the economy will recover in the shape of Nike swoosh logo. However, it depends on the development of the pandemic. So in which kind of crisis we are in can be referred to several years ago. Because several years ago, when we had a global financial crisis, the economic growth rate was negative 6%. However, now it is getting worse to negative 7.6%. disaster. A disaster has unequal effect. However, at the same time, it is serving as a foundation for social transformation. As seen in the case of the Black Plague, it offered the opportunity in the medieval times to shift away from the medieval time to the modern times. And when the Spanish flu came in 1980, the Europe and the US saw 0.5% or 1% of their population die, but India, the death rate was 6%. Amid COVID-19, 70% of those who died of COVID-19 are African Americans. And at the time of the financial crisis in 1998, the vulnerables are hit earlier and harder for much longer period of time. So this is about how the world will change in the post-COVID-19 era. I think that it depends on the extent of change. And these are the extracts from the news report. So before corona and after disease. So it's a shift from BC to AD. So this is a thing that I have extracted from the newspaper reports. So there used to be materialisms and Maimonisms, but I really hope that from the post-COVID-19 pandemic era or the crisis, I hope that people can reflect on themselves, thinking, looking back on what has happened in the past, environmental destructions, and so on. So, but at the moment, in order to tackle the situations, governments around the world are providing funds in order to relieve people from the burden of the COVID-19 situation. And deglobalization is going on in this post-COVID-19 era, but we need to think about ㅅVice trap. So G2, there were G2s and two powerful countries, and so there was a shift from G2 and G1. And so in the past, when you look at the history, there used to be two superpowers, but after waging wars, we ended up having G1, just one superpower, for example. So there is a war in between on emerging power and established superpower. So what direction we need to take for the future in terms of social policy? Growth only or growth-centered mindset brought about the pandemic. But now we need to move away from that mindset. Now we need to set an objective in terms of government administration, putting happiness first rather than growth. And secondly, what matters most is that so far, over the years, we just put a focus on economic growth. So in terms of the per capita GDP, Korea ranked 29th among the OECD countries. However, when you take a look at the social and environmental indicators, Korea is in bad shape all too often. So it is very important to strike a balance and make a harmony between social, economic, and environmental sustainability. So that would be the desirable state. And this is the third point. I'd like to talk about the golden quadrangle model. So the golden quadrangle model is needed in these times. When we take a look at the past policies, the economic, labor, and welfare policies were introduced and implemented in a separate manner. That's why we could not achieve the desired outcome. For example, as for labor policy, we generated many irregular workers. However, in terms of welfare policy, the government emphasized on providing benefits. So the two sometimes were in conflict with each other. So we need to take a integrated and more consistent approach for economic, labor, and welfare policies rather than a fragmented approach. And I'd like to move on to the next topic. So we need to establish a society that is based on low cost And low-cost society was talked about a previous speaker, National Assemblyman, Mr. Lee. And as time goes by, the desires and the needs are growing exponentially. However, in order to meet the desires and needs, we need a lot of resources. However, we don't see an increase in resources much. So this is based on a hypothetical situation. For example, when we take a look at the lowest income people, and they are subject to the national basic livelihood subsidy or the insurance program. But these days, primary school students, if they don't have smartphones, they cannot, go on their life these days. And their desire is to have smartphones. However, even if there is a desire, but that desire cannot be met if they don't have resources. And this kind of deficiency issue is related to the social issue. In order to tackle the problem, historically, nations were focused on extending welfare policies and introducing many other measures, like forming cooperatives. So that was the previous approach. However, we need to think outside of the box. Why don't we think of creating a society where needs and desires are lower than now? For example, we are spending a lot of costs and a lot of money on private education. But what about a society with no private education? That indicates that it is the society with low levels of desires and low levels of needs. The same goes to the medical cost. So we are sometimes in Korea spending medical costs in a too excessive manner. In order to provide high level of welfare benefits, people are saying that we need to spend a lot of money. It makes sense in some cases. And having more doctors in the current situation can be one of the options. However, at the same time, we need to think about how to build a society with low costs. That means that less numbers of diseases instead of having more doctors in the current situation. And this is the medical cost situations of the United States. And please compare the numbers between countries, the United States, Korea. In the COVID-19 post-era, in the post-COVID-19 era, so what approach should we make? Even if we spend less money, we will be able to establish a better society if we take a different approach. This is about the establishment of the inclusive welfare system. As for inclusiveness, this is what I'm thinking. The former President Roh Moo-hyun, maybe I need to skip this part, but the president knows that the river water goes continuously into the seawater. But from that point of view, sea does not distinguish river water from seawater, whether it is dirty water or clean water. Actually, the sea actually is inclusive of the river water. And that's the concept of inclusiveness in my view. So this mechanism is needed for making a virtuous cycles between consumption, investment, and job numbers, and so on. And this is about the inequality indexation tax. And inequality indexation tax was claimed by Mr. Robert Shiller. So Mr. Shiller is a Nobel laureate. According to his theory, so we need to make a linkage between the income inequality to taxation. If the income inequality goes up, that means that a more heavier taxation should be given. Taxation should be imposed to the companies, for example. So depending on the level of income inequality, tax can be different according to his theory. And another thing is the one that I thought of, expanding the social value-based tax system. Once a society evolves, there are some jobs that are gone away, and there are jobs that are created. So there will be more jobs that will be lost rather than the number of jobs that will be created. So this is what I thought. Why don't we expand the social value-based tax system? That means that the companies who hire more workers, they are given with the tax cut benefits so that companies' profit can be about the same after either paying wages or paying tax. And I'd like to move on to the next one. What should be the direction for social policy in the post-COVID-19 era? So there is a national insurance policy for all the citizens. So recently, according to the announcement of the government, they announced that they would implement the Korean-style New Deal policy. I think that actually in an ideal situation, economic, environmental, and social sustainability should be in a balance. In order to enhance the quality of lives, the sustainability between economy, environment, and society needs to be guaranteed. For social sustainability, we need human New Deal, not just New Deal policy. What I mean by human New Deal is the extension of employment safety net as well as the social safety net. So digital New Deal and the Green New Deal actually are weighed heavily. But having the national insurance systems for all of the citizens of the nation may not be proper consideration. So in order to establish a Korean-style New Deal, I think we need to adopt the idea of human New Deals based on the combination of employment safety net and social safety net. When it comes to social safety net, we should guarantee the income for the aged. So that's why I'd like to argue for reorganizing the income security system for the aged. At the moment, we are in a situation where we are on the train of Snowpiercer, just like the movie. So there are more luxurious cars in the train, and there are less luxurious cars in the train at the back. So within this current systems, we cannot guarantee the age, the income security. So that's why absolutely there is a need to reorganize the income security systems for the nation. And secondly, we need to introduce the benefits related to the sickness and the injury. Among 36 countries in OECD, only the US and Korea are not adopting the sickness and injury allowances. In Korea, the sickness and injury allowances is not in place. For example, those who are working on site at Coupang and at delivery companies like that. So even if they are sick, they cannot make ends meet. That's why, because they are not given any benefits like the sickness and injury benefits. That's why, even if they're sick, they keep working and working. So we need to introduce a sickness and injury allowances to Korea. And when we think about the situation of working moms, they have difficulties, especially when their children are primary school students, like especially the graders from 1 to 3. So we need to think about introducing children's allowances for primary school 1 and 2 and 3 graders. And this is the last part. So what should be the direction for social policy for the future? What I want to make a suggestion here is that there are people who are falling into the category of special employment. I think that it is desirable for them to be part of the employment insurance, because employment insurance is part of the social security systems. But at the moment, those who fall into the category of special occupation, they are not insured of employment insurance of the nation. And you can think of the government officials and the government officials are questioning me whether it is right to be insured of the insurance system for employment. But I think that this is the right way to go. And this is the last part of my presentation. Rather than quality of jobs, our first priority should be improve the number of jobs. So job sharing or extension of jobs in the public sector can be thought of. And these are the things that we need to work on. So at the moment, in this current situation, rather than increasing the quality of jobs, we need to focus on increasing the number of jobs. Thank you for listening.
Thank you, the research fellow, Mee Gon. So what should be the direction, the social policy of Korea for the future was well presented by your presentation.